Hi, hello everyone. So welcome to discussion of NEET PG 2024 PYQ test and discussion series. Hi, hello everyone. Am I audible and visible? Audio video is it clear? Can you just interact with me? So as you know, forensic medicine is one of the very important subject, very important scoring subject for your upcoming NEET PG exam. So in this session, I'm going to discuss 30 questions. 30 questions. The questions are already given to you. Let's discuss what are the important discussion points related to each question and also some image based question. Yes, Dr. G, ready? Yeah, Dr. G, fine. So the first question in your paper about the rigor mortis. So rigor mortis, one very important topic, very commonly asked in your exam. Rigor mortis, cadaveric spasm, liver mortis, ulgar mortis, all these are very commonly asked. The first question about what are the all are true regarding muscular changes after death except what are the muscle changes after death except is the question, right? So what is the answer? So the options are rigor mortis occurs 1 to 2 hours after death, cadaveric spasm involves involuntary muscle, rigor mortis involves voluntary muscle, rigor mortis involves involuntary muscle. As you know, in our discussion classes, rigor mortis means shortening and stiffening of the muscle and joint because of the ATP depletion, right? ATP depletion. What is the answer? Can you try this? Can you try? Yes. Try all of you. Yes. Okay. Option A, rigor mortis occurs 1 to 2 hours after death. That is true statement. Okay. That is true. It occurs because of ATP depletion. So when there is ATP depletion, there is no separation of actin from the myosin. So muscles will be in the contracted state. That is true. Rigor mortis involves voluntary muscle. That is true. Rigor mortis involves all the muscles, voluntary muscles as well as involuntary muscles. The first muscle is heart. The first voluntary muscle is eyelid. The last muscle is fingers and toes. Okay. It involves involuntary muscles also. Rigor mortis is a postmortem change that involves voluntary muscle as well as involuntary muscle. The first involuntary muscle is heart. The first voluntary muscle is eyelid. The last muscle is fingers and toes. So C and D also correct. Cadaveric spasm involves involuntary muscle. That is wrong. That is wrong. Okay. Cadaveric spasm is an antemortem phenomenon that involves only voluntary muscle. The most common voluntary muscle is the muscles of the forearm and the hand. It is also known as cataleptic rigidity. So the answer is B is the correct answer. B is the correct answer. Fine. Look at this. So this is rigor mortis. Rigor mortis. What is rigor mortis? Shortening and stiffening of muscle and joint. Why is it occur? Because of ATP depletion. There is a rule applicable to rigor mortis that is known as rule of 12. Rule of 12. So this can be asked. Rule of 12 is applicable to rigor mortis. Shaffer rule applicable to rigor mortis. Niston rule applicable to rigor mortis. All this can be asked in your upcoming exam. And one more commonly asked question is, what is the differential diagnosis of rigor mortis? There are three important differential diagnoses. One is cadaveric spasm. Second one is heat stiffening. And the third one is the cold stiffening. All these are very, very commonly asked question. Go through this topic in detail about it. Rigor mortis and differential diagnosis and medical legal importance. So this is about the question number 1. And one more very important topic that can be asked in your exam, differences between rigor mortis and cadaveric spasm. Okay, cadaveric spasm. Like rigor mortis, you can see here rigor mortis, muscle stiffening is not marked. Cadaveric spasm, it is well marked. Molecular death occurs in rigor mortis, does not occur in cadaveric spasm. And when you see, the heat at the site, it is usually cold in rigor mortis, but in cadaveric spasm, warm in nature. The muscle do not respond to electrical stimuli in case of rigor mortis because there is a cellular death. Muscle can respond in case of cataleptic rigidity or cadaveric spasm. So all these are very commonly asked question. Differences between rigor mortis and cadaveric spasm, one very, very important topic. Okay. Yes, Dr. G, any doubt in this? Dr. G and other students, any doubt you can ask me in this? So rigor mortis also known as acid rigor. This can be asked. What is alkaline rigor? That is cadaveric spasm. Okay. Second question. Second question about again postmortem change. One very important topic is adipose formation. Environmental condition needed for adipose formation. Options are hot and dry, free air movement. Option B, humid and cold. Option C, warm and humid. Option D, cold and dry. What is the best answer? Yes, Dr. G, Nayaz, and your drug of choice. Very good answer. Many answered correctly. Okay. Okay, let's discuss about it. Okay. What is adipose here? Adipose here means saponification. So there is a formation of calcium salt of fatty acid after that. So hot and dry and free air movement, that is required in case of mummification. Mummification it is. So it is not the answer. Cold environment. No, it is not cold environment. It should be warm and humid environment. Okay. The best answer for this question is warm temperature and humid environment. It is not cold temperature. Okay. In cold temperature, all this decomposition enzyme, they're going to die. There won't be any postmortem change. Okay. So like in case of embalming or when dead body is placed in freezing compartment. So answer is warm and humid. If the same question asked mummification, your answer should be hot and dry and free air movement. So adipose, mummification and decomposition, very commonly asked in your exam. You must know in detail. Okay, so the answer is C is the correct answer. Nia's very good answer. Okay, now question number 3. Question number 3 is about asphyxia. In asphyxia, the important topics are hanging, strangulation, suffocation and drowning. Very frequently asked question. Hanging, drowning, very, very commonly asked in NEET PG exam. What are types of drowning? What are the postmortem changes? Medical legal importance? Very frequently asked question. Last structure to be autopsied in asphyxia death. What is last structure? So, remember, in asphyxial death, especially in case of hanging or in case of strangulation, the first cavity should be opened. Anything other than that is neck. So the answer last is neck is the correct answer. Neck. So once you dissect all the cavities like cranial cavity, thoracic cavity, abdominal cavity, the area become avascular. Once the area become avascular, all the findings are visible very clearly. So, and one more thing, Prince-Clow-Gordon artifact. Remember this. This can be asked in your upcoming exam. Prince-Clow-Gordon artifact. So this is an artifact. It is an unreal thing that occur after death, especially the blood stasis at the areas of the neck, especially trachea and the cervical vertebra. That is known as Prince-Clow-Gordon artifact. So the answer is neck. One more question, remember, the incision is modified Y incision. Modified Y incision. Your drug of choice is asking, should we expect IPC in NEET PG? Maybe at least one question, but not more than one. Because IPC is going to change. The question can be asked, IPC is going to become, or IPC is going to become BNS. Bharatiya Nyaya Samhita. They can ask this type of question. Or CRPC going to become BNSS. So already we have a lecture in YouTube, in PW Meded next. You can go through that. Okay, what is BNS or BNSS, BSA that can be asked. Are some important IPCs, especially dowry death, medical negligence, perjury, that can be asked in your upcoming exam, but chances are very minimal. Okay, so this is about the question number 3. You need to go through all the important points. Anyone can you guess? There is a ligature here. Can you see the ligature in the image? What is the site of cutting the ligature? What is the preferable site of cutting the ligature in case of hanging or in case of any death actually? Can you guess what is the answer? I asked Dr. G and drug of choice, what is the site of cutting the ligature material at the crime scene? Yes. Come on, try. Okay. So answer is not the thyroid. So it is opposite to knot. Okay. You can see the knot here. You need to cut opposite to knot. Very simple it is. And one more question can be asked is, what are the autopsy techniques? Last year, NEET PG exam, there were 2 MCQs, especially from autopsy techniques, like Virchow technique, Rokitansky, Letourneau technique. You must know this. And also you must know skin incision. Skin incision, one very important topic. Skin incision, autopsy techniques. Last year 2 questions. Techniques. A question can be asked about embalming or exhumation, or this year question can be asked about autopsy instrument also. Okay. Yes. So Mr. Perfect is okay. Fine. Next we are talking about incision. Incisions are very commonly asked. Y, modified Y, and also X-shaped other incision, inverted Y, that can be asked. So this is frequently asked. So this is Y, modified Y. So all these are commonly asked question. Okay, commonly asked question in your exam. Okay. Yes. Now question number 4. One very important question, conceptual question. Following is most suggestive of ante-mortem hanging. Ante-mortem hanging means the person was alive at the incident of hanging. He was not killed in the beginning. So he was alive actually. So what is the answer? Options are salivary dribbling, head bone fracture, cervical vertebral fracture, oblique ligature mark. This is very frequently asked question in your exam, especially from the chapter asphyxial death. Hanging is a subtopic. Okay. Yes, come on. Yes, who is going to answer this? Let's see who is going to try. You can make mistake, no issue. You can make 100 of mistakes in the class, but don't do the same mistake in upcoming exam. Yes, come on, all of you. Can you try this? Can you try? There is no problem. There is no wrong in trying the question. Okay. Dr. G is telling C is the answer. Cervical vertebra fracture. Yes. Any other? Mr. Perfect. A. A is by Dr. G. Yes. So antemortem hanging. Whenever question asked antemortem hanging, anti matlab before death. Postmortem means, that is, post means after death. So your answer should be salivary dribbling mark. This is very important find. Whenever you see salivary dribbling mark at the angle of mouth, usually opposite to side of knot. Okay, that is the feature of antemortem drowning. So the answer is A is the correct answer. Very good, many answers. Head bone fracture. One more very important topic. Head bone fracture, types of head bone fracture like abduction fracture, adduction fracture, other fractures are very commonly asked in your exam. You must know in detail about it. Cervical vertebra fracture, that is very common in judicial hanging. That is a cause of death in judicial hanging. That is also known as hangman fracture. Bilateral fracture of pars intraarticularis known as hangman fracture. That is seen in judicial hanging. So, C, not the answer. Oblique ligature mark. Oblique ligature mark seen in case of hanging, but not the feature of antemortem hanging. That is the question asked in your exam. So, the answer is A is the correct answer. A is the correct answer. Okay. And remember differences between hanging and strangulation, types of suffocation like burking, or traumatic asphyxia, all these are very frequently asked. You need to go through that in detail. That is given already in the lectures. The question number 5. A case of hanging has come to forensic department for autopsy. Autopsy surgeon notices a ligature mark covering about 1/3 of neck, protruded tongue, salivary stain, open left eye, closed right eye. Okay, so open left eye, closed right eye. Both the pupils are dilated. So what is this known as, or what is the probable reason for open right eye? Yes, come on, try. Even all of you, can you try this? So you can see in the picture there, one eye is open, other eye is closed. That is a feature of antemortem hanging. What is the finding known as? The finding is lay face is sympathetic. Okay. The finding is, yes, Naya's. The finding is lay face is sympathetic. Let me write this. Lay face is sympathetic. Okay. What is the reason for that? The reason for that is compression of cervical sympathetic chain. Okay. Usually on the same side of the. So the answer is C. C is the correct answer. Dr. G, good answer. This is what the lay face is sympathetic. What we can see here, on the same side of the knot, eye remains open, the pupil is more dilated. That is a feature of antemortem hanging. It is seen in around 20 to 30% of the cases. Now one important topic. is drowning. Very frequently asked in your exam. All are true about findings in case of drowning except is the question. Except है इसमें, ठीक है ना? Except is there. Option A, average duration of washroom and hand in drowning are 2 to 4 hours, wrinkling and shortening of fingertips. So wrinkling and shortening occurs in 2 to 4 hours. 4 to 8 hours, bleaching of epidermis. Bleaching occurs at 4 to 8 hours. That is true. 24 hours, entire hand shows bleached, wrinkled, sodden appearance. 48 hours, peeling of cuticle from the palm and sole. 3 to 4 days, skin can be peeled off like a glove. So it is a very important statement. This is known as washerwoman hand. This is a true statement. True statement it is. Okay. Washerwoman hand, you can see here. So this is the classical washerwoman hand. Washerwoman hand. Okay. Washerwoman hand. What we can see in washerwoman hand, wet appearance, wrinkled, soddening is there. So this occurs in case of drowning, but it is a non-specific finding. So A is a true statement. Fatal period in drowning, 4 minutes in fresh water, 6 to 7 minutes in sea water. That is also true. That is also true. Okay, true statement. Washerwoman skin merely a sign of immersion is not a sign of antepartum drowning. Yes, it is true. Can be seen in other conditions like hypothermia also. The washerwoman hand looks like trench foot. Okay, in hypothermia. That is also true. Emphysema aquosum is a finding seen in unconscious drowning. It is wrong. Okay, C is wrong. Emphysema aquosum, we call it as frothy lung. The frothy lung is a feature in case of conscious drowning. Okay, it is not in unconscious drowning. In unconscious drowning, we usually see edema aquosum. So the answer is D is the correct answer. Very good. Dr. G answered. Nayas and your drug of choice all answered. That's great. The answer is D is the correct statement. The wrong statement here. D is the answer. Emphysema aquosum is also known as frothy lung. You will see a lot of froth, and also you will see the mucus and the froth collection at the cut section, and rupture of alveolar epithelium is a feature of emphysema aquosum. It is seen in conscious drowning. Watery lung, we call it as watery lung. That is seen in case of edema aquosum. That is in case of unconscious drowning. So D is the answer here. Good. Now anyone can identify what is the finding here in case of drowning? One very commonly asked question. What is the finding in case of drowning? Look at this right answer. You can see the clenched hand with aquatic matter, weed, aquatic matter, or some aquatic plants in the hand. It shows that it is a case of antepartum drowning. What is this sign known as? Can you guess? Yes, my dear students, try hard. Cadaveric spasm. Very good. This is known as cadaveric spasm. It is also known as cataleptic rigidity. Okay, cataleptic rigidity it is. Yeah, good answer. Many answer. That's really nice. Okay, this is frequently asked question. Okay, very frequently asked question. Exam cadaveric spasm. It's antepartum find. Okay, now we are into the next question. All of you try this. Try. A 50-year-old man died due to road traffic accident as a result of shock and hemorrhage. Identify the autopsy finding, the type of abrasion given below. Options are graze abrasion, pressure abrasion, imprint abrasion, scratch abrasion. Dear students, abrasion very frequently asked in your NEET PG exam. Abrasion, contusion, laceration, stab wound, incised wound. You must know in detail about it. Okay. One topic is abrasion. As you know, abrasion is a superficial injury. It involves epidermis. There is no scar formation. Heals within 1 week. The question here is type of abrasion. So what we can see here, parallel lines. You will see parallel lines like this. Here, can you see the parallel lines due to the road traffic accident, because of the friction between the vehicle and the person, or the surface and the person? What is this known as? Yes, so this is known as Gray's aberration. Very good. This is known as Gray's aberration, and answer is correct answer. Yes, Nias, Dr. G, and all they answered correctly. Answer is Gray's aberration. Gray's aberration is the most common aberration commonly seen in road traffic accident. It is also known as brush burn, friction burn. You will see parallel lines. By looking at the parallel lines, you can identify direction also by looking at the denuded epithelium. Frequently asked question, NEET PG exam. Pakka question, very, very important question. Pressure abrasion seen in hanging, strangulation. Imprint abrasion seen in, again, road traffic accident. Example is tire mark. Scratch abrasion, also known as linear abrasion. So, types of abrasion very frequently asked. In case of hanging, it is known as pressure abrasion. Okay, so this is very frequently asked question, you must know. Look at this. Can I identify now this abrasion? Can I identify this abrasion? Look at this picture. A case of road traffic accident. You can see the parallel lines and also denuded epithelium. Looks like bone injury known as brush bone. What it is? What it is? Yes, drug of choice, Dr. G. Very good. This is nothing but your Gray's abrasion. ये होगा Gray's abrasion. Very, very frequently asked. Dear students, very frequently asked question it is. Now look at this. A case of asphyxia, case of hanging. What we can see, dry hard parchmentization. What is this? What is this type of abrasion? Yes, right. We'll see dry hard parchmentization. Dry hard parchmentization that is seen. This must be, yes, this must be pressure abrasion. Very good. All the answer, great. Great it is. So, pressure abrasion, correct answer. Great. Now the question is about the blast injury. Blast, bomb blast. One more very commonly asked question in our exam. Okay, it's like primary blast injury, secondary blast injury, tertiary blast injury, quaternary, quinary, all is a frequent blast injury. What is solid blast? What is underwater blast? All these are air blast. What are the common organs involved? So blast injury, one more very important topic. You must know in detail about it. So this question about blast injury. A male was brought dead in casualty with a lacerated wound over the anterior chest. Multiple punctate abrasions, multiple punctate laceration, and multiple abrasions are. So, which is the true regarding mechanism of above injuries? See, these injuries like laceration, abrasion, and bruises, they are punctate. Lab मतलब क्या है? Laceration, abrasion, and bruises. There are multiple punctate. So this is known as Marshall's triad. Okay, Marshall's triad of blast injury. Marshall triad of blast injury, which is a secondary blast injury. Secondary blast injury. Secondary blast injury. What is the reason for secondary blast injury? Flying missiles. Okay, the answer is flying missiles or secondary blast injury. So the answer is A is the correct answer. A is the correct answer. Good, many answered. A is the correct answer. Primary blast injury because of the blast wave. Blast wave. So when there is a blast wave. So because of the air blast, common organs involved are, so one is the tympanic membrane, lung and intestine. Tertiary blast injury because of victim displacement. Quaternary blast injuries because of the structural damage. So the most common and the most frequent and the most dangerous is secondary blast injuries because of the flying missiles. So the answer is A is the correct answer. And in the picture, what you can see here, so you can see in the picture, you can see the multiple abrasions, multiple contusions are there which are punctate. They are known as Marshall's trap. Marshall's trap. Good. Now, question number 9. Question number 9. Again, one important topic in NEET PG. Frequently asked. NEET PG 22, 23, 21, INICET, FMG. Very important topic is trace evidence. That is blood stain and seminal stain. Okay, frequently asked question, blood stain. Blood, seminal stain, DNA fingerprinting, polygraph, all these are commonly asked. So the question asked about blood stain. A suspected blood sample has been evaluated. Following observation is noted under microscope. So what is the observation here? You can see the brown here. Brown. Okay, rectangular type of particle seen. Okay. So what is this? Anyone can answer? Anyone can answer this? I remember like this. Brown color hai na? Brown man. Man. Teak man. So remember this. It is a Teakman test correct answer. Teakman. How to remember? Brown man. Okay. Brown man. And remember, in case of Takayama test, you will see pink feathery crystals. Pink feathery crystals. I remember Takayama mama pink color. Takayama pink color. Benjidin blue color. Benjidin is a screening test. Barbario test is a test for seminal stain. Very frequently asked. Very, very important. Very, very important, all of you. Barbario test. Florence test. Confirmatory test. Very frequently asked. Seminal stain, you need to go through that at least 5-10 minutes about the seminal stain. Around 10 minutes for about that is blood stain. So here answer is Teakman test. So that is brown. Good. Now look at this. This is the very important image. Pakka question. 100% there will be one question from this. Look at this. Teakman test. Teakman test. Brown rhombic crystals. Brown rhombic crystals. Very important. Brown rhombic. Takayama test, also known as hemochromogen test. Pink feathery crystals. Barbario test, spermine picrate crystals, yellow needle shaped crystals. Florence, because of the cholinidal crystals, dark brown rhombic crystals. So this is very important image. There are 4 to 5 MCQ that can be framed from this. Either question can be asked, what is the principle of Barbario test? Your answer should be spermine picrate crystals. Florence test, choline iodide crystals. What are confirmatory tests for blood stain? Takayama Teakman test. What are the confirmatory tests for seminal stain? All these are frequently asked. Okay. Answer is good. PG answers are rhomboid crystals, picric acid. So picric, that is a Barbario test. Beta Barbario test. Now this is the question. Simple question. Now you can try. Barbario test used for the identification of which of the following? Remember Barbario. Barbario basically for what? Seminal stain. Seminal stain at the crime scene can be identified with the help of Barbario test. Acid phosphatase test. Okay. So what is the best answer? The answer is semen is the correct answer. Okay. Semen is the correct answer. And the finding here is yellow needle shaped crystals. Yellow needle shaped crystals of spermine picrate. When spermine is there in the seminal state, that combines with the picric acid that forms spermine picrate crystals. Okay, 7 is the correct answer. Blood, remember, TNT, TNT, Takayama test and treatment. CSF, no, usually not asked. Species identification can be done with the help of precipitin test. Precipitin, frequently asked question. Precipitin test. Okay. So this is all very frequently asked question. Pakka question in exam. Blood stain you have to go through. Seminal stain you have to go through. DNA fingerprinting, polymerase chain reaction, and also species identification. All these are discussed in previous classes. Okay. So that completes the 10 questions. Now question number 11. Very interesting question. Very interesting question. Identical twins have similarities in all the following except identical twins. You can see in the picture here. Identical twins. So blood grouping, DNA fingerprinting, fingerprint pattern, VNTR. VNTR. Let's see now. Let's solve this question. What is VNTR? Variable number tandem repeats. That is the principle of DNA fingerprinting. So it can be same. VNTR can be same. What is VNTR? Variable number tandem repeats, also known as microsatellites in introns, is a principle of DNA fingerprinting explained by Alec Jeffrey. VNTR can be same. DNA fingerprinting definitely same in both. Not the answer. Blood group also can be same. What is the answer then? Fingerprint is the correct answer. Fingerprint, very frequently asked. Dear students, there are some 2-3 important topics of identification. One is the fingerprint. Types of fingerprint. What do you mean by delta point? Okay, delta point. Most common fingerprint, least common fingerprint. Very commonly asked. Second thing, Gustafson method. Pakka question, Gustafson method. Third question, superimposition. Teeth eruption. Okay, and dental charting can be asked in upcoming exam. Dental charting. One more very important topic. Tattoo, very frequently asked. 1 or 2 questions about tattoo. Okay, so the answer is fingerprint pattern. Now look at this. There are 3 types of fingerprint. Okay, the first one is a loop. This is the most common one. Mole, that is the second common type. And arch is this. Okay, when you see like this. Okay, so this is the loop. Arch means like this. You can go through that. Pole means you will see central circle. Central circle. Okay. You can go through that, all this. And who discovered fingerprint? Anyone can you guess? Who discovered fingerprint? Simple question. Can you answer this? Who discovered fingerprint? Try this. Who discovered fingerprint? Okay. Okay. Yes, Henry Galton system. Good answer. Jeffrey discovered better DNA fingerprinting. Okay, Matt. Jeffrey discovered DNA fingerprinting. Fingerprinting. Okay. Francis Galton. है ना? Francis Galton. Good. Good answer. Next. Gustafson method. One very important question. Gustafson method is very important, very frequently asked. This is very important topic, okay? This method is for age estimation. Okay? Commonly we use antedated. It has 6 components. How many components? 6 components. The mnemonic is script. Must be knowing in our classes. We discuss like this. Script is a mnemonic. It's a method of age estimation from teeth. The best criteria among the Gustafson. Options are root resorption, parodontosis, translucency of root, attrition. Anyone can you guess? Anyone? See, attrition matlab loss. Loss due to wear and tear. Loss due to wear and tear. Not the answer. It is not the best criteria. Parodontosis means loosening of the teeth. Loosening. Not the best criteria. Root resorption? No. This is translucency of the root. So whenever question asks best criteria, translucency of the root. Second best criteria, secondary dentin. These two are very frequently asked. The most important criteria, translucency of root. Second best criteria, or second important criteria, or second reliable criteria, secondary dentin. It is not primary dentin, secondary dentin. And also, one more question asked, incremental lines. Incremental lines are seen in cementum opposition. Okay. We have certain method known as Boyd's method. Frequently asked question in NEET PG exam. Boyd's method. Okay, so there are 30 PYQs are there. All 30 PYQs. Okay. So there are 6 criteria. Attrition, periodontosis, secondary dentin, cementum opposition, root resorption, root transparency. The best is this. The best criteria. Best criteria. Second best criteria. This is the second best criteria. Very important topic. ये याद रखना. Very important topic. Very frequently asked. Frequently asked. So I am teaching forensic medicine since last 10-12 years. Gustafsson method is one question very frequently asked. It's a microscopic examination of teeth for age estimation. It includes 6 components. Mnemonic is APSRTC or script. Okay? Yes. Fine. Now, question number 13 from legal procedure. Courtroom procedure. Like, courtroom procedure very commonly asked. The question can be asked about oath, examination chief, cross-examination, re-examination, or questions by the judge. Very frequently asked. Let's see the question. While recording evidence in court of law, the lawyer asked the witness, did A kill B in your presence? Did. Okay. This is the leading question. Yes or no type of question known as leading question. Yes or no type of questions are known as leading questions. The witness said yes. Yes. Was there at the crime scene. This type of question would be permitted in which procedural route in the court of law. Leading questions are asked in. What is the answer? Like, can you see? Leading questions asked in cross-examination. Very good answer. Answer given by R. Beta, very good. Leading question matlab yes or no type of question. A question has answer in it. They are asked or permitted in cross-examination, but not in examination chief, except in case of hostile witness. Yaad rakhna, it can be asked in hostile witness also. Hostile witness in examination chief. Examination in chief. Remember this? When witness is found to be hostile, leading question can be asked in examination chief also. Okay? Now look at this. This is the way we teach in our classes. Courtroom procedure. We have judge. We have public prosecutor. We have defense lawyer. This is the courtroom procedure. Has 5 steps. It has oath. Second, examination in chief. Examination in chief. Cross-examination. Re-examination. Lastly, question by the judge. The 5 basic things given in standard textbook, right? Anyone can answer What is the time period for cross examination? What is the time period for cross examination? Let's see who is going to answer. Okay. अच्छा, हॉस्टल विटनेस समझ में नहीं आया. अच्छा ठीक है. See, हॉस्टल विटनेस मतलब यू टर्न विटनेस. यू टर्न. यू टर्न पता है ना आपको? यू टर्न मतलब हॉस्टल विटनेस इज इक्वल टू यू टर्न विटनेस. यू टर्न मतलब during police investigation he said he is the witness. He said, okay, I am the witness, I was there in the crime scene, I have seen the murder, like something like that. But during courtroom procedure, he is telling opposite. No, I was not there in the crime scene. I am not the witness of the crime. So he is changing his statement from police investigation into the courtroom procedure. So now he can be considered as hostile witness. So in hostile witness, public prosecutor can ask question. Okay? ठीक है? Mr. R, what my point? U-turn. Yes, Mr. R. Great it is. Great. Fine. Okay. Acha, Albert Pinto. Okay, this courtroom procedure very important. Remember that. Okay. Now important topic, all of you. Now question number 14 is about intracranial hemorrhages. There will be one question for sure from EDH, SDH, SAH or intracerebral hemorrhage. Pakka 100%. You can write in the book. Pakka question. I'm telling you, pakka question. Okay? Either it can be EDH or all this topic. Okay? Patient came with a history of head injury. CT scan is given below. Diagnosis is. So what we can see here, there is a hemorrhage. There is a hemorrhage which crosses suture line and which is concave or convex. What is the answer? So this is definitely SDH, concave or convex, which causes suture line. It's because of bridging veins. Common in old age, common in boxers, common in shaken baby syndrome. I know SDH is the correct answer. In EDH, you will see biconvex. And SAH commonly involves base of the brain at the circle of Willis. ICH is intracerebral hemorrhage because of the hypertension, because of the stroke. So the answer is C is the correct answer. Anna, idli shape, Anna, idli. Very good. Good answer. This is a very important picture. Very funny way you can remember. Where in exam it is concave or convex. Banana shape. Banana hoga subdural hemorrhage. Concave, convex, crescent shaped hemorrhage because of the bleeding from bridging veins. Common in elderly people, alcoholic, SDH hoga. If it is biconvex, lens shaped, idli shaped, because of bleeding from middle meningeal artery, that is nothing but your epidural hemorrhage, lemon shape. And these two very important questions. याद रखना, funny way, lemon and banana. Okay, these two. Banana होगा SDH होगा, lemon होगा EDH होगा. ठीक है? EDH. Idli, that is EDH. Idali, we say Idali like this, right? Idali. E for Idali, E for EDH. EDH. Can you remember like this? Idali shape. Good. This is important question. Anybody? What is the finding? What is the finding or what is the cause for subarachnoid hemorrhage? Subarachnoid hemorrhage. What is the frequent cause? Frequently asked question. Very easy question. Can you try? Can you try this? Try. Hypertension. Okay. Hypertension. Fine. So if yes, trauma, okay, hypertension, trauma, trivial trauma, fine. Because of bleeding from intercirculation of circle of Willis. याद रखना, berry aneurysm. Berry aneurysm. Whenever question asked, Worst headache of the life, berry aneurysm, young person, sudden death, nuclear, all this, your answer should be worst headache of life, SAH. Yes, SAH. है ना? SAH. Next, look at this beautiful picture. Beautiful picture for understanding. This is EDH and SD. Okay. Shaken baby syndrome can be asked. SBS. Points drunk syndrome can be asked. PDS. Okay, these two can be asked. Types of SDH can be asked. Acute, subacute, and chronic. EDH, lucid interval is seen. What is lucid interval importance can be asked. Drunkenness is the differential diagnosis of EDH. Differences can be asked. How to give certificate in drunkenness can be asked. So all these are very frequently asked. Yes, basically for SDH. SDH में होगा subdural hemorrhage. In shaken baby syndrome also subdural hemorrhage is seen. In punch drunk syndrome, okay, that is also SDH. Fine. Now next question. Next question is a very nice question. From hyperthermia, one frequently asked question is burn injury. Burn. Very frequently asked question. Either question come from rule of 9 or heat artifacts, or the question can be come from heat stroke, heat syncope. Okay, here is the question from heat syncope, heat stroke. Okay, so look at this. A daily wage laborer who was working in the field in a hot weather collapses with the loss of consciousness. So he's having loss of consciousness. When higher centers are involved, it must be heat stroke. The case of heat stroke, also known as sunstroke. Sunstroke. Patient was brought to hospital. Attending doctor measured his body temperature. It is around 106. Higher. Which of the following least likely present? Least likely present. Least. Not most common. Least likely present. What is the answer? Options are hypotension, tachycardia, hot skin, and sweating. What is the answer? Yes. So the answer is sweating. Yeah. Sweating is absent in case of. The answer is this. What happens? In heat stroke, there is a failure of hypothalamus. There is an involvement of hypothalamus. So when there is a failure of hypothalamus, the heat regulation is affected. In heat regulation affected, there will be no sweating. So the answer is D is the correct answer. Okay. One more question can be asked. That is, what is ulgar mortis? Ulgar mortis is frequently asked. Ulgar mortis. Okay. Ulgar mortis you must know. Now we are into the ossification center. Ossification center. D. Very good. All answer D. Cooling. Now one important question. As per POXO Act, POXO means protection of children from sexual offences. So it is about the case of rape, juvenile rape, when victim is juvenile, less than 18 years. But 18 year means juvenile, less than 18 juvenile. Okay, male or female, it's applicable to male child also, female child. A child is brought for age estimation. Age estimation. What is the exact age? Less than 18 or more than 18? What is the exact age? X-ray wrist taken. What is the age of the child? Age of the child. Come on. Yes. Try now. Try. Can you try all of you? What is the age? Age. Look at the lower end of radius. Look at the lower end of radius and lower end of ulna. I'm not going to discuss in detail. It takes a lot of time. So radius and ulna both are unfused. Both are unfused. You can see here it's unfused. Here both are unfused. What is the answer? What is the answer? Come on, try. Unfused. You can see here unfused. Must be less than 18 years. है ना? Less than 18 years. The answer is less than 18 years. Less than 18 years for sure. So it is not D is the answer. And look at the carpal bones. See, most of the carpal bones appeared. You can see here pisiform also appeared. Okay, pisiform appeared. Pisiform appeared. When it appears, anyone can guess when pisiform is going to appear? Yes, yes. When pisiform is going to appear, let me tell you. Pisiform matlab it is given 9 to 12 years or 9 to 11 years. Appeared it is. Okay, you can see the pisiform there. Form is appeared. So it is not 4 to 6 years. 7 to 8 ये भी सही नहीं है. The best answer 9 to 11 years. 9 to 11 years, less than 18 years. Less than 18 years, that is 9 to 11 years is the correct answer. Pisiform appeared. Look at this. Look at this now. What is the age? Can you guess what is the answer? What is the age? Look at the radius and ulna. Radius and ulna both appeared and fused. Radius and ulna. Both fused. The lower end is fused. You can see here. Lower end is completely fused. What is the age? What is the age? More than 18 years, beta. Radius and ulna fusion होता है more than 18 years. When you are more than 18 years, radius and ulna fused. Adult. मतलब adult. ठीक है? 18 years, radius going to fuse, ulna going to fuse. Okay. So what is the answer? It's more than 18, less than 18. More than 18 or less than 18? Yes. This must be more than 18. 18. है ना? Good it is. So, fine. So this is very frequently asked. X-ray. X-ray of the wrist. Very frequently asked. Okay? Very commonly asked in your exam. You need to go through this X-ray joint, elbow joint, shoulder joint, age of ossification, and also the age of ossification center around the pelvic joint. Frequently asked. Okay? More than 18. More than 18. Adult. Good. Now, question is identify the sign given below. Next question is about the regional injuries. One more frequently asked question. Regional injuries. Frequently asked. What you can see here in this picture, there is a hemorrhage around the masted process. Masted process, there is a hemorrhage because of middle cranial fossa fracture, because of head injury, because of road traffic accident or assault. What is this finding known as? Sixpenny bruise? No. Sixpenny bruise is seen in manual strangulation. This is very commonly asked question. Throttling में होगा ही. Sixpenny bruise है ना? That is commonly seen in throttling, asked in NEET PG exam. Raccoon eye, seen around the eye. Raccoon eye because of fracture of anterocranial fossa. Not the answer. Magnon sign. Magnon sign is seen in cocaine poisoning. Not the answer. Answer is battle sign. Because of the middle cranial fossa fracture. Is first explained by surgeon William Battle. Okay, answer is battle sign. Okay, battle sign. Good. Good, good, good. Now look at this battle sign. 4 B's are there for battle sign. B for battle sign. Bruises seen. Basilar skull fracture behind the ear. If you want, you can remember like this. Battle, battle. Whenever question asks battle sign, always battle, bruise, basilar skull fracture behind the ear. Look at this. What is this finding? Anyone can you guess? What is the finding and what type of bruise is this? What type of bruise is this? Anyone can you guess? What type of bruise is this? Come on, try all of you. Try. This is known as spectacle hematoma, raccoon eye. है ना? So this is contusion, right? Panda eye, that is also correct. Raccoon eye, panda eye. Okay, collection of blood around the eyes, contusion, known as bruise. Bruise, contusion, both are same. So it is a one more example for anyone. Can you guess what is that? It's an example for something, trauma is somewhere and injury is somewhere. Trauma is over the forehead, injury is here around the eye. What is that known as? There is a migration, no? What is the answer for that? Can you answer? R, PG. Yes, yes, yes. Come on, come on. Who is going to answer that? Yes. Come on. This is not croup, beta. Croup nahi hai. Croup and counter को पे telling, right? No, it is not croup. This is migratory bruise. Okay. Migratory bruise. Also example for, okay, ectopic bruise. Ectopic bruise. Remember this. Migratory bruise. Okay, good. It is a okay. Because coop and counter coop lesions are seen usually over the brain. Now my question is around the eye. A bruise, ectopic bruise, also known as migratory bruise. No worry. It is a migratory bruise or ectopic bruise. Trauma is somewhere, injury is somewhere. Because of collection of blood in the gravity area. Simple it is. Now some questions from toxicology. Toxicology, right? So last INACET exam, there was a question from cyanide poisoning. One of my favorite topic in class is cyanide poisoning. So like amyl nitrate, all this question asked in last exam. Okay. So we have a strike rate of 100% in FMT especially. So question number 18. A 45-year-old woman presents to emergency room after ingesting unknown substance. Unknown substance given by some stranger. Given by some stranger. So when I give history, some stranger, unknown substance. So I remember cyanide Malika case or cyanide Mohan Kumar case. I have seen the web series Dahad. So I remember that. Okay. So cyanide Malika, cyanide Mohan Kumar, Dahad, all this based on cyanide poisoning one. So she is confused, reports having headache, nausea, vomiting. On physical examination, hypoxic, histotopic hypoxia that is seen. Unique almond smell. Unique almond smell. One more clue here, almond smell. She was given with activated charcoal. Oxygen supplementation does not improve her hypoxia. See, when you give oxygen, normally in case of carbon monoxide poison, there can be some improvement. She started empirically on nitrate and thiosulfate. Best possible diagnosis. So the question is big, but answer is very simple and very simple it is. What is the answer? Okay. Okay, no problem. So answer is this is cyanide poisoning. Cyanide poison. Why cyanide poison? Because of bitter almond smell. Bitter almond smell. Second thing, no response on giving oxygen. Third, treatment is nitrate. So what nitrate? It can be amyl nitrate or it can be sodium nitrate and sodium thiosulfate. So three important drug used in case of cyanide poison. We say Trimurti. Trimurti. What are Trimurtis? Amyl nitrate, sodium thiosulfate. Very frequently asked in your exam. Okay. Very frequently asked. Okay. Amyl nitrate is given in emergency through inhalational route. Sodium nitrate, sodium thiosulfate given through intravenous route, through the same needle, or the same route, that is, same cannula we can say. So sodium nitrate and sodium thiosulfate. Anyone can you answer what is the mechanism of giving sodium nitrate? What is the mechanism of giving sodium nitrate in case of cyanide poisoning? Hello, who is going to answer this? Yes, yes, Lily Kate. Fine, okay. Anyone can answer? Come on, try. Try. Who is going to answer? Yes. So, sodium nitrate that forms methemoglobin. Okay, it forms methemoglobin. Methemoglobin combines with your cyanide. It forms cyanomethemoglobin or cyanohemoglobin. Cyanohemoglobin combines with sodium thiosulfate. It forms water soluble salt. Okay, that is a simple method, simple mechanism. So, cyanide has more affinity towards methemoglobin. When methemoglobin, oxygen both are there, cyanide will go with the methemoglobin because it has more affinity. Cyanomethemoglobin. Cyanomethemoglobin is an unstable compound. It combines with sodium thiosulfate. It forms water soluble salt. So this is the principle of giving all these agents. Okay. Carbon monoxide poison. Drug of choice is oxygen, as you know. Very important. Hyperbaric oxygen. Hydrogen sulfide. One question asked in NEET PG exam 5 years back. Detergent technique of suicide. Japanese detergent technique of suicide that involves hydrogen sulfide, drainage gas. Garage death? No, garage usually carbon dioxide or carbon monoxide. So answer is, it is A, correct answer. Good. This is a very important thing, very commonly asked question in exam. Smell. Very frequently asked, beta, very important. Bitter almond, cyanide poison. Burn trope. Burn trope is seen in cannabis poison. You know, bang, charas. Cannabis poison is burn trope. Fruity, paraldehyde. Garlic, phosphorus and arsenic both. Musty, zinc, aluminum phosphide. Pear, chloral hydrate, which is known as dry wine. Rotten egg, hydrogen sulfide. Shoe polish, nitrobenzene. This is very important. You need to mark this. Okay. You can take the screenshot and we can preserve or we can save somewhere. So this is very important. Smell is very commonly asked. One more question asked is the color. Okay. Yes, getting my point, all of you. Getting my point? Yes. Reply me in the group. Okay. Cyanide Malika case, cyanide Mohan Kumar case. Cyanide is very frequently asked. One of the ideal suicidal, ideal homicidal. It causes sudden death. It causes histotoxic hypoxia. So it can involve various organs. Cyanide poison. The postmortem hypostasis is pink color. Some books use bright red color also. Okay. So all these are common. Amyl nitrate is used. Sodium nitrate used. Sodium thiosulfate used. Hydroxycobalamin is also used. Okay. Now we are talking about next topic. That is next question. This is the question about the snake bite. A patient presented with a history of snake bite with a ptosis, paralysis, external ophthalmoplegia, unable to speak, raise the head in supine position, which is known as broken neck sign. Most probable species implicated. What is the answer? What is the answer? Can you try this? Try. Yes, so this is a neurotoxic snake bite. Hai neurotoxic. Yes, neurotoxic. The answer is common cobra. Very simple. All vipers are vasculotoxic. The answer is common cobra. Good. Sandeep, good answer. R also good answer. Good. Good. So what is the important topic here? Big four snakes. What are big four snakes in India? Big four snakes. So one is Russell's viper, known as Dabai russeli. Common kite, known as Bungaru ceruleus. Indian cobra, which has a spectacle mark and a hood, Naza naza. Lastly, saskade viper, Achis carinatus. Okay, all these are known as big four snakes. All four are neurotoxic. Among this, which is the most venomous snake? Can you guess? Among these snakes, which is the most venomous snake? Can you guess? Most venomous, anyone? Whose fatal dosage is 3 to 6 milligram. 3 to 6 milligram dried venom can lead to death. Dried venom. Sandeep is telling cobra. And the young drug upjohn is also telling cobra. 3 to 6 milligram common crate. The common crate is the most venomous. It is presynaptic. Okay, presynaptic. Presynaptic it is. Low dosage, even 3 milligram of dried venom of common crate can lead to death. Causes neuromuscular paralysis, respiratory paralysis and death. Okay. Next question. Next question is about the acids and alkalis. One more frequently asked question, like carbolic acid, sulfuric acid, nitric acid, oxalic acid, frequently asked. We call it as corrosives, right? Corrosives. Okay. You must know alkali and acids. Acid is very frequent. A 2-year, 2-month-old boy admitted an interval of 10 hours with a bone injury. So on examination, what are the findings? Findings are CNS depression. There is a CNS coma. CNS coma is there. Constriction of pupil. Constriction of pupil. Smoky urine. Carboluria. Carboluria is there. Cartilage deposition is there, which is known as uchronosis. And also cornea deposition. So all these are known as 5 C's of carbolic acid. Carbolic acid. Answer is carbolic acid. Answer is carbolic acid is the correct answer. Finding here is coma, constriction of pupil, carboluria, cartilage, cornea deposition. The fatal dosage is around. Okay. Around 10 to 20 ml and 3 to 4 hours. Death can occur in 3 to 4 hours. Nitric acid, you will see xanthoprotic reaction, yellowish discoloration. Hydrofluoric acid is also known as flesh eating acid. Flesh eating acid, where you will see liquefactive necrosis. Sulfuric acid, we normally see black tongue, stomach perforation, and also teeth. That is, teeth can be whitish. So this is the finding. Anyone can you guess? What is this triad? What you can see here? Corrosion of the teeth. Okay, corrosion of the teeth. What you can see the black tongue here. What is this acid poisoning? Black tongue is seen in, very commonly asked. Okay, chalky white teeth. Chalky teeth. We call it as chalky teeth is common in. And also multiple perforation of stomach. Multiple perforation. What is the diagnosis in autopsy? Black tongue, chalky teeth, multiple perforation in stomach. Your answer should be. Anyone? Can you guess? No, it is not lead, beta. Rohan Haldar, Sandeep Bura. Sulfuric acid. Very good. It is sulfuric acid. So, whenever question asked multiple perforation of stomach, your answer should be sulfuric acid. Leathery stomach, carbolic acid. Carbolic acid, leathery stomach, hardening of the stomach. Sulfuric acid, you will see multiple perforation. It's one of the strong acid which causes coagulative necrosis. The answer is yes, sulfuric acid is the correct answer. Ilam Azizi, good afternoon, beta. We are in the question number 20. Last 10 questions are there. Now, question number 21. For 21, talking about question number 21 now. Say example is a NEET PG question. Read the question, try to answer. We can make 100 of mistakes in the class. Okay? Yes. A 25-year-old woman brought to emergency room by her friend after being found unconscious in her car while it was turned on. He reports that he is unsure less than an hour had passed. He saw her in the kitchen. And on examination, there is an improvement on giving 100% oxygen. 100% oxygen. So options are cyanide poisoning, carbon monoxide poisoning, hydrogen sulfide poisoning, Argemona mexicana poisoning. One more important poisoning, Argemona mexicana, very frequently asked. Yes, I used to teach in that institute. Yes, I used to teach. Anyone can guess what is the answer for this? Answer for this. So patient came with a history of poisoning, some inhalational poison. On giving oxygen, there is an improvement. Can it be cyanide poisoning? No. Cyanide nahi hoga. Cyanide, there is no improvement on giving oxygen. Cyanide, we need treatment, that is antidote. Sodium nitrate, amyl nitrate, sodium thiosulfate. So cyanide, not the answer. Argemona mexicana. Argemona mexicana, which causes epidemic dropsy. Epidemic dropsy, very frequently asked question. Beta, oxalate, aminoalanine, all these are frequently asked. Okay, so not the answer. Hydrogen sulfide, also not drainage gas, not the answer. Answer is carbon monoxide. Carbon monoxide is the correct answer. SIBO is the correct answer. Okay, yes, you are sanguinary. Yeah, sanguinary. Latheriasm we have, that is BOAA, beta oxalate aminoalanine. Yes. Argemona mexicana, sanguinary. Sanguinary. है ना? Sanguinary. Good answer. Good. Causes epidemic drops. And remember one more very important question. In carbon monoxide poison, you will see cherry red discoloration. Okay? Cherry red postmortem hypostasis. Very frequently asked. Cherry red PM hypostasis. This can be asked as an image based question. Cherry red. Okay? This is a very important table. 100% pakka there can be question from this. The color of postmortem hypostasis. Cherry red or pink color, carbon monoxide. So it is given ulta here. Cherry red in case of carbon monoxide, pink in case of cyanide. Hypothermia pink, sodium chloride brown, hydrogen sulfide green color. Hydrogen sulfide green color. Go through the postmortem hypostasis and the color. Okay. Yes, brick red also cyanide. Some books gives brick red is cyanide. Okay, pink is a color that is seen in case of hypothermia. Hypothermia. Anyone can you guess brown color? Where in case of brown color or yellow color? Yellow or brown color? Anyone can you guess? Yellow brown PM hypostasis seen in. Very good, great answer. Phosphorus. Very good. Yellow phosphorus. Remember yellow phosphorus. Red phosphorus is non-poisonous. This can be asked in your exam. Red phosphorus is non-poisonous. Only yellow phosphorus is poisonous. Anyone, there is a syndrome or there is some syndrome name is given to yellow phosphorus. What is that syndrome name? In case of yellow phosphorus, you will see, fumes are coming out from the stools. Because of that finding, there is one important syndrome related to yellow phosphorus poisoning. What is that? Can you guess? What is that? Come on, your drug of choice, Roaccutane, yeah. Yes, come on, students, come on. What is the syndrome in yellow phosphorus poisoning? Repeat question in INA CET exam, NEET PG exam, FMG exam. Very good. Your drug of choice, beta, you are excellent. That is known as Smoky stool syndrome. Smoky stool syndrome. Smoky stool syndrome that is seen in case of yellow phosphorus poisoning. The fumes of yellow phosphorus coming out from the stools during examination. So that is the name given, smoky stool syndrome. Okay, a bad name, smoky stool syndrome. Okay, that completes the question number 20. Now question number 22. Look at this very important question. Again, I discussed many times in classes. Snake bite, scorpion bite, very commonly. Pakka question from toxicology: snake bite, scorpion bite. Remember neurotoxic? All this, common crate and common cold are neurotoxic. Vipers are vascular toxic. Okay. So the question asked here: a girl of age 10, otherwise healthy, sleeping on the floor, suddenly develops nausea, vomiting, abdominal pain, quadriplegia at night. So some type of stroke, some stroke-like picture. Okay, it resembles like stroke. Suddenly quadriplegia, vomiting, nausea, abdominal pain, stroke-like picture in a young healthy girl. Uncommon age for stroke. There is no swelling or burning pain at the site. So the fang marks are invisible. Fang marks invisible. Invisible. 2 points here. Mild convulsions. Convulsions are there mild. Mild convulsions, but toxemia is very high. Paralysis is very, very high. Patient is drowsy with minimal convulsions. Increase albumin in the urine. Anyway, that is a common finding. What is the answer? Yes, come on, come on. So this is, remember, answer is either viper bite or common cobra. Not or crate bite, right? Or it is scorpion bite. Scorpion bite pain is maximum. The pain is the commonest feature in scorpion bite. So scorpion, no. Viper bite. Viper is a vascular toxic. Vascular toxic. Neuroparalysis very rare. So viper, no. Common cobra or crate. The answer is common crate bite. The answer is common crate bite. Common crate bite resemble like stroke, and the action is presynaptic. It causes muscle paralysis. It causes sudden death in their sleep. So answer is crate bite. Okay. Look at this. This is the crate. Anyone? What is the scientific name? What is the scientific name of this? Scientific name of scientific name. Why not B? Okay, better remember in cobra bite, you will see fang mark. Fang mark is commonly visible in case of cobra, and cobra at the side there will be pain. That's why. Okay. Crate bite fangs are very small. Fang mark are not visible, and pain at the site is absent. That's why. Okay, that is the reason for that. Hello. Anyone can guess what is the scientific name of this? Elapide. Yes, you are right. It's Elapide. But what is scientific name? Common crate. Common crate. What is the scientific name? Come on. It's Elapide. Fine. Elapide. Okay. This is, yes. This is Sahil Thakur. Bungarus ceruleus. Very good. This is Bungarus ceruleus. Bungarus ceruleus. Bungarus ceruleus. Very cunning snake. I remember like this ceruleus. Very cunning. Cunning Jason snake. It has a tendency to bite people without stimulus. Without stimulus. It will be roaming in the night when someone is sleeping around. So it will take a chance. It will bite and go. Very cunning. I remember like this ceruleus means cunning snake. Bungarus ceruleus snake. And remember one more point here. It is presynaptic. Okay. Presynaptic. Presynaptic. Remember, action is presynaptic. Cobra action is postsynaptic. It is presynaptic. Okay. Neostigmin, is it useful? Anyone can guess? Anyone? Anyone? What about the neostigmin? Is it useful in case of common crate bite? Neostigmin. Anyone? Is it useful in case of common crate bite? It is useful in cobra, but not in crate bite. So, crate bite it has no value because it's presynaptic. Yeah. No, Sandeep Bora, good answer. So, you can see here. So, there are transverse white mark. Whenever I see transverse white, transverse lesions are there, whitish lesions are there, must be common crate. A steel black color, it is common crate. Common crate is steel black in color, it has a transverse lines over the body. So no triangular head. Triangular head is seen in vipers. Okay. Treatment is same, that is antivenom. Polyvalent antivenom is the treatment of choice in case of common crate bite. Good. And the cause of death is respiratory paralysis. Respiratory paralysis. Now question number 23. A 5-year-old boy brought to emergency room lapsing in and out of consciousness. In and out of consciousness. That means altered consciousness. Having altered consciousness, but no smell of alcohol. So it is not a case of ethyl alcohol poison. Okay, 5-year-old definitely no. So, mother reports 30 minutes ago the young boy was found exiting from a garage severely confused. Container of freshly spilled antifreeze. Antifreeze is there. Next appropriate step would be to administer. Anyone, what is the poisoning here? Anyone can you guess? Altered consciousness. In a case of alcohol poison, which is commonly used as an anti-freezing agent in motor vehicles. Anti-freezing agent. What would be the correct answer? What is the poisoning? Can you guess now? Come on. Sahil Thakur, beta. Sahil. Best. Sahil Thakur, he said it is ethylene glycol, sir. Very good answer. This is asked in your recent exam. Do you remember that? In INSET exam, ethylene glycol was asked. Calcium oxalate crystal. Coffin lid shape or some shape is given, no? So ethylene glycol, there is a formation of calcium oxalate crystals. Calcium oxalate crystals is the antifreeze agent. So dimethylcapral, no, it is not given. N-acetylcysteine, no. Clomazanil, no. Clomazanil given in benzodiazepine poison. Fomepizole is the correct answer. So the answer is D. So fomepizole can be given in methyl alcohol poison. It can be given in ethylene glycol poison. So both the condition it can be used. The answer is D is the correct answer. So ethylene glycol is the answer, anti-freezing agent. Whenever in the exam, altered consciousness, resemble like drunkenness, but without smell of alcohol from the breath, your answer should be ethylene glycol. Very important clinical feature. Okay. Okay. Now so this is the ethylene glycol mechanism asked in your recent exam. Ethylene glycol is converted into glycoldehyde. As you know, alcohol that converts into aldehyde. Aldehyde होगा. Aldehyde is converted into acid, glyoxylic acid. And remember, it also produces oxalic acid. Oxalic acid combines with calcium, forms calcium oxalate crystals. And also there is a formation of hippuric acid when glycine combines with the benzoic acid. And beta hydroxy, that is beta ketoadipic acid. So what is important here is fomepizole, which is an inhibitor of competitive inhibitor of alcoholic dehydrogenase enzyme. The very important point here is fomepizole is a competitive inhibitor of alcoholic dehydrogenase enzyme. This is a very important point. You can highlight this point. Okay, highlight this point. Okay. About the ethylene glycol, this can be asked in your NEET PG exam. Now we are talking about 24. Again, your INS-ET question. Very commonly asked question in your exam is alcoholism. What are syndromes of alcoholism? Either question can come from DT, delirium tremens, Wernicke encephalopathy, Korsakoff psychosis, Marchi-of-Bignomi syndrome, are legal aspects of alcoholism. Frequently asked. Like Widmark formula can be asked, legal limit of alcohol can be asked. So here is the question about the alcoholism. 46-year-old male chronic alcoholic underwent an emergency operation for lung laceration. 24 hours later, he developed anxiety tremors. So he developed tremors, anxiety, insomnia, unable to sleep, psychotic symptoms, and confusion. All this started, it's an acute phenomena, right? Acute phenomena. Patient started on benzodiazepine and thiamine, multivitamin, IV fluid. What is the probable diagnosis? What is the answer for this question? What is the answer? So this is classical case of alcohol withdrawal syndrome, right? Alcohol withdrawal syndrome. Alcohol withdrawal syndrome. Around 48 hours. You can see here around 48 hours or 24 to 48 hours. So that is okay. Tremors are there, right? Tremors are there. So I'll go with delirium tremens. Okay, delirium tremens common sense. Alcoholic hallucinosis, no, not exactly. Wernicke, you will see global confusion, ophthalmoplegia, ataxia. You remember the mnemonic Goa. Remember the mnemonic Goa. Wernicke is equal to Goa. Welcome to Goa. Welcome to Goa. Goa party after exam. After June 23rd exam. Goa party. Right. Welcome to Goa party. So welcome means Wernicke. Welcome Wernicke. G for global confusion. O for ophthalmoplegia. A for ataxia. So I'll write here global confusion. Global confusion. Ophthalmoplegia. Ophthalmoplegia. Ataxia. Feature of what? Wernicke. So it's not Wernicke. Opioid withdrawal, no. Opioid withdrawal has different signs and symptoms and is also chronic alcohol. What is the best answer? Answer is delirium tremens is the correct answer. Remember, welcome to Goa. Very commonly asked. Anyone, what is the difference between Wernicke and Korsakoff? Wernicke and Korsakoff, anyone can you guess? Wernicke and Korsakoff, what is the difference between the both? R and R, Mr. Sahil Thakur. Anyone? One word answer. I need one word answer. One word answer I need. Anyway, okay. Your drug of choice said confabulation. Very good. Filling memories. Very good. Filling memories. Antegrade amnesia. Very good. Acute. Very good. KK said acute and chronic. Best answer given by KK. KK said, sir, Wernicke is acute. Korsakoff is chronic. Wernicke is acute. Korsakoff is chronic. Very good answer. What you can see here, Wernicke is acute phase. Acute phase. You normally see confusion, ophthalmoplegia, ataxia, thiamine is given. Korsakoff is chronic phase, characterized by retrograde amnesia, antegrade amnesia, confabulation, and psychosis. Psychosis means insight is absent. Insight is absent. This is very, very important one. You must know. And the mnemonic is quote track. One more mnemonic is quote track. The quote is for the Wernicke. Rank is for the Korsakoff psychosis. So the treatment is vitamin B1 is given. Anyone, what is the pathogenesis of this? What is the pathogenesis of this condition? Anyone can guess? Why is it occur in case of vitamin B deficiency? What is the pathogenesis in alcoholism? Yes, come on. No, basically no. See, this Wernicke Korsakoff is a it has overlapped symptoms. Overlapped symptom. So basically, ataxia, ophthalmoplegia, all is seen in Wernicke. Amnesia, confabulation, psychosis seen in case of Korsakoff. One is acute, hoga, one is chronic. Okay, simple it is. PDH defect. Okay, how PDH can lead to this? Sahil Thakur. Yes, how vitamin B1 and why all these symptoms? Yes, come on. Try. What is the pathogenesis? What is the pathogenesis of Wernicke-Korsakoff syndrome? Come on, beta, come on. BCA. What is the BCA? I think it is okay. PDS defect. That is pyruvate dehydrogenase defect. You were telling Sahil Thakur. Low thiamine. How low thiamine leads to this? My question: how low thiamine leads to these features? I think this is simple. I know mammillary body. Okay, mammillary body. Okay, what is that? So remember demyelination. You know, for myelination and all, we need vitamin B1. So I think that is the reason behind all this. You can go through that again. There are multiple theories of pathogenesis you can go through. But vitamin B1 is given. Thiamine is given. Very, dry, very, wet, very commonly asked. Right? Good. Now question number 25. Question number 25 again. It is alcohol. Yes, it's alcohol. Not alcohol. Look at this. One more common abuse, drug of abuse, illegal drug, common drug of abuse is 17 year, मतलब juvenile, है ना, juvenile attend to addiction. What type of addiction? Alcohol is common, cannabis is common, है ना, cannabis, heroin, all these are common addictions. 17-year-old male brought to his family physician by his parents due to his behavior, increased appetite. He has increased appetite, eating a lot. है ना? Lack of motivation. He has a motivational syndrome. No motivation on tea. No motivation to do new things. Paranoia. Paranoia is there. Okay. Run amok. Run amok. What is run amok? Anyone can guess? What is run amok? What is run amok? Anyone? Come on. What is run amok? Run amok क्या होती है बताओ? Run amok. Run amok is a impulse disorder characterized by compulsion to kill person, killing people. It's a homicidal mania. Homicidal mania, killing people, killing strangers, killing enemies, or killing whoever that is. It's a impulse disorder characterized by impulsive killing. Run amok. So euphoria is that. Euphoria, anxiety, disinhibition when interviewing the patient. Slow speech, conjunctival ingestion is there. So what is this? So options are delirium tremens, cannabis addiction, Wernicke encephalopathy, nicotine. Yes. So nicotine addiction, definitely no. Nicotine is cigarette, no, nothing. Wernicke Gova we discussed. That is Gova party we discussed. Global confusion, ophthalmoplegia, ataxia. Delirium tremens, we normally see tremors and also alcohol withdrawal syndrome. It is. Cannabis addiction is the correct answer. Okay. Cannabis addiction. The answer is cannabis. Cannabis addiction. Cannabis addiction. What are the preparations of cannabis? What are the preparations of cannabis? Can you guess? Come on. What are preparations of cannabis? Yes. Come on. Who is going to answer? Cannabis. What are preparations? We say weed, charas, cannabis cookies, cannabis sweets. Can you guess some preparation? Bong, charas, good, charas. Ganja, beta, very good. So look at this. There are 5, 6 preparations are there. I think you can make out. Can make out. Can you make out these preparations one by one? What is this A? A क्या होती है? B, C, D, E, and also F. Tell me what are these? Tell me what are these? Need to identify. Laddu. Laddu is acha, good. Karela juice. Okay, who said Karela juice? Related to cannabis, beta. Related to cannabis, not Karela. A is bang. Who said A is bang? Very good. ये होता है bang. Bang. 9-hydrocannabinol, which is present in bong, around 5 to 15 percentage. B, that is a sweet prepared from the cannabis, laddu. Sweet laddu, that is your mazoon. ये क्या होता है? मजून होता है, मजनू नहीं, मजून. Mazoon, Mazoon, Mazoon. ठीक है. अच्छा, ठीक है. These are all cannabis cookies. Cannabis cookies you can see here. Cookies, biscuits. And D, that is bong. Very good. Many identified. No, not smart bong. This is ganja. This is ganja. Ganja. That is weed. That is. E क्या होते बताओ? E. E that is charas. है ना? This is charas. Charas also known as hashish. Hashish. And this is cannabis oil. Cannabis oil, which is the most poisonous. Most poisonous. All is a preparations. All is a preparations of cannabis, and taking these cannabis for a long time can lead to run amok syndrome, emotional syndrome, and other features of psychosis. Okay. Hashish oil, good. Cannabis oil is hashish oil. Good answer. Many answered. Okay. Fine. Now question number 26. Last 5 questions. Last 5 questions. Interact with me. We are going to complete your PYQs or 30 PYQs. A 3-year-old child sleeping in a hut. Again, I discussed many times in your classes. Scorpion is very commonly asked. Okay, scorpion. Let's see the question. So here patient is having lot of pain, screaming. So patient is having lot of pain. One important feature in scorpion bite is pain. Extreme degree of pain. Patient will be screaming because of the pain. Pain because of the stimulation of nerve endings. And patient is having sweating. Okay, sweating. Why is sweating? Because of release of neurotransmitters like epinephrine, norepinephrine from the adrenal gland. Patient is having cold extremities. Vomiting is there. And patient BP is low BP, and tachycardia and pain. All this go in favor of what is the answer? The answer is BP is low. Yeah, BP is low. Yes, BP low hai. What happens actually in the beginning, BP can be high, but at the final stage, the BP is low in case of scorpion bite. So, as you know, the function of epinephrine, norepinephrine in pharmacology, there is a different vasomotor phenomena of Daley and all, right? So, there can be BP low, and the pulse is also 150. Snake bite, no. Snake bite pain will be there, but not that high. Food poisoning, definitely no. Septic shock fever is not given. Scorpion bite is the correct answer. And remember, treatment of choice is antivenom. Antivenom is given. Okay. Prazosin is also tried. Prazosin. Prazosin is a can give atropine also. Edema. Okay. Scorpion is a very important question. Can be asked in a okay. Okay, yes. But here treatment है ना. So when you give prazosin here, it will cause more decrease in BP. So here it is not, prazosin is not given. The best answer is antivenom. Okay, the best answer is given only when BP is high. So this is what the scorpion. Scorpion. This is the scorpion venom. Scorpion venom it is. So what type of venom? Anyone can you guess? What type of venom it is? Is it cardiotoxic, myotoxic, and neurotoxic? What type of venom is this? What type of venom is this? Come on. Who is going to answer this? Venom. Death is very rare in case of scorpion bite, okay, because the venom injected is very small. Death can occur only in the children, not in the adults. But death is very, very rare. There can be complications, there can be all these features, but death is very rare because venom is very small. But the venom toxicity is more than snake bite. When you compare scorpion venom and snake venom, scorpion venom is more toxic than the snake venom. Okay. Okay. So neurotoxic, hematotoxic. Okay. Vivek is telling sir neurotoxic. Kyle telling neurotoxic. Sugama Dex telling hematotoxic. Yes, it can be anything. It can be neuro also. Vaso also, it can be cardiotoxic also. Anything. It has multiple toxic phenomena. Okay. So there are different stages of scorpion sting. Stage 1, there can be swelling and severe pain. Stage 2, all these increase heart rate, vomiting, diarrhea, breathlessness. And stage 3, high blood pressure. And the last stage, that is a multi-organ failure. That is because of the involvement of the brain, liver and kidney. So there are different stages. Drug of choice is scorpion antivenom. Okay. Now question number 27. One more very important topic in your exam is deliriant. So in deliriant, the question can come from cocaine. Question can come from cannabis. Question can come from datura. Okay. All these are important. Just go through these topics. Go through this topic. One other source. Okay. Yes. Now look at this question. A guy was playing in a garden. So guy it is given, probably children, it is child. Suddenly collapsed, was rushed to hospital. He was having irritability, restlessness, dry, hot skin, was unable to pass urine and stool, difficulty in passage of urine and stool, dysuria. So patient is having all 90 manifestations. So some unknown poison, commonly present in the garden, accidental poisoning. I know. So what is the answer? So 90 manifestations, 9D clinical features. I think we discussed many times in classes. 9D clinical features. 9D clinical features are seen in datura poison. What are 9D? All this, okay, dryness, dryness, dilation, dysuria, difficulty, all this D, death also, muttering delirium that can be seen, carpologia that can be seen. So all these go in favor of datura. Okay, datura, D. So datura is what? Datura consists of hyoscine, hyoscyamine, atropine. Hyoscine, hyoscyamine, atropine. So what should be the drug that is given in treatment? The answer should be physostigmine. Answer is physostigmine. Datura poisoning and answer is physostigmine. It is not oleander. Oleander is a cardiac poison. Pralidoxime is given as OP poison, not in case of datura poison. Look at this. This is the frequently asked question. Can you identify this fruit? Can you identify this fruit? Come on. Can you identify this fruit? Come on. What is this? You can see the apple there, green apple there, right? Green apple with the spiny projections. What is this? Green apple. What you can say? Green apple. This says spiny projection, single and spiny. Single fruit. Spiny projections. So ये होगा datura. This is known as corn apple. Very good answer. Corn apple. Apple is good for health. Corn apple is very bad because it causes delirium. Yeah, corn apple it is. Corn apple. So in corn apple poison, the treatment given is physostigmine. Anyone? What is the medico-legal importance of this? Medico-legal importance of this? Can you guess? What is the medico-legal importance? Come on, answer this. Medico-legal importance. Come on, try. What is the medico-legal importance? Where is it used? Yes, come on. Railway poison. Beta, very good. It's a rail poison. Railway poison. Road poison. मतलब क्या होती है? What do you mean by road poison? What do you mean by railway poison? Road poison. मतलब क्या? What is the meaning of that? Robbing. Very good. Is used by robbers in trains and buses. It is mixed with your food. Okay, it mixed with the food. It consists of seeds. So it resembles like chili seeds. So it is mixed with the chili seeds or mixed with your food. Basically your sambar or basically your chutney. You know, sambar. So taking sambar, chutney, having food with the strangers in train. Who knows? They can be a well-known robbers. They can rob you, or sometimes sexual, that is also rape. Rape can be happened, or children kidnapping. Kidnapping, yes, kidnapping, kidnapping, all this. That's why it is not a rail poison. Good. And in this, there is a muttering delirium. Remember, muttering delirium. And in case of delirium, there is one classical sign. What is this known as? Like this, no. What is there is one sign in case of datura poisoning? Patient will be doing like this, doing some or pulling some imaginary thread. It is he's having some hallucination like this. What is that known as? He'll be doing like this all the time. Like this will be doing. Okay, what is that known as? Thread. A bed sheet, है ना? What is that known as? Very good. Sahil Thakur said, sir, ये होता है carpologia. Very good. Sahil, carpologia. Very good answer. A type of imaginary, hallucination. Yeah. Carpologia. Good answer. Good. Also important question. Chili seeds, differences between chili and datura seeds. Very commonly. Anyone, what is the shape of datura seeds? What is the shape of datura seeds? Shape of seeds. Can I answer this? Shape of seeds. Okay, your drug of choice said, sir. Oh, okay. Sahil Thakur, Dr. Jain, all said. Beta, you are best. Okay. Best. Kidney shape. Very good. Kidney shape. And they are double edged. They are double edged. Remember this. Double edged. What is the fatal dosage? Can you guess fatal dosage? Fatal dosage of the datura seeds. Fatal dosage and a fatal period. Fatal dosage क्या होती है बताओ? Fatal period is what is the answer? Treatment. Okay. 100 seeds. Very good. Fatal period 24 hours. Treatment is physostigmine. Physostigmine. Good answer. Physostigmine is given. 100 to 150. What is the fatal dosage of 𝐒𝐿-𝐶? Can you guess? 𝐒𝐿-𝐶. There is a mnemonic in forensic medicine. 1, 10, 100. Anyone can you guess? 1 is for fatal dosage of what poison? 10 is for fatal dosage of what poison? 100 is for what? Anyone can you guess? So 1 is for 𝐒𝐿-𝐶. 1 is for 𝐒𝐿-𝐶. 2 is for, that is 10. 10 is for Ricinus communis. Ricinus communis, castor plant. 100 for datura. So, all of you remember 1, 10, 100. 1 𝐒𝐿-𝐶. 10 Ricinus communis known as castor seeds. 100 datura seeds. Done. Done, 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 done. Done and dusted. Okay, all of you? Okay. This is very important question. All of you okay? Are you getting my point? Hi, my dear students. How is the Josh in forensic class? How is the Josh in forensic class? Batao, tell me, tell me, tell me. I'm just waiting. Good, good answer. Good. Great. Are telling great. Sahil Thakur telling yes. Beta, very good. All interacting with me. That's really great. Really great. Hi, sir. Yes, sir. Hayan Datura. Okay, Hayan Datura. Good, good. Dr. Jain telling yes. Good. Now we are talking about question number 28. One more very important topic, that is your cocaine poison. Cocaine is very costly. Right? So cocaine costly. Young teenage boy with a history of drug abuse had been installed with a shot of intravenous cocaine at a party. So party गई था ये. So he was a party man, party boy. So he is rushed into emergency room by his friends. Some of the symptoms were diaphoresis, so he's having lot of sweating, headache, acute coronary spasm because of vasoconstriction. Which of the following symptom would go against the diagnosis of cocaine poisoning? Very good question. Cocaine, cocaine is my favorite topic. Cocaine, and also favorite topic of NEET PG. Every year you see FMG, INA, CET, NEET PG. They ask one question about in this cocaine. So, cocaine, in what happens in cocaine, basically there's increased norepinephrine. When there is increased norepinephrine, so definitely it leads to hyperthermia. Hyperthermia, yes. Agitation, yes. Ischemia, yes. Bradycardia, no. There is no bradycardia. So answer is very simple. B is the correct answer. Remember cocaine, also known as white lady. White lady is cocaine. Okay. And in cocaine, you will see one very important symptom, Magnum symptom. Magnum symptom. Magnum symptom. What is Magnum symptom? Can you answer this? What is Magnum symptom? Magnum symptom. Sugamadex. Sugamadex. All, come on. Try to answer. What is Magnum symptom? Patient will be doing like this, like this, like this. Very, annoying actually. Look ugly, like this. What is that? What is that known as? What is that known as? You will get scratch mark. So when FMG exam question asked, multiple scratch mark is seen over the body. Patient died due to some poisoning. What is the poisoning? Cocaine. I know. Remember scratch mark. Okay, good. So Magnum symptom is a tactile hallucination, also known as formication. Patient feels that insects are crawling under his skin. So you'll be having some hallucination of insects crawling under his skin. There will be multiple scratch marks known as Magnum symptom seen in case of cocaine poisoning. Okay? Insect crawling. Very important question. So याद रखना, this is carpologia. This is carpologia. This is Magnum symptom. Magnum symptom. What is this in forensic medicine? Like this weed in the hand. What is that we discussed in previous classes? Weed in the hand. So not the cocaine, I'm telling you, not the cannabis. Weed or aquatic plant in the hand. What is this symptom known as? Like this, tight muscle contraction. We can say, antemotum phenomena. What is that known as? What is that known as? Okay. Good. Cadaveric spasm. Cadaveric spasm. That is good. Good answer. Good. Great answer. Vivek Pathak are all answering. It's really great. So remember cocaine poisoning. There's a very nice mnemonic. कोला, कोकेन कोला. कोला मतलब क्या होता है? तो black color tongue. Okay, you will see black color tongue because of vasoconstriction, because of gangrene. This is important finding. Okay, black tongue, black teeth is seen, gangrene of nose, earlobe. All is because of vasoconstriction. When there's an extensive vasoconstriction, there will be gangrene. Cola. Remember, cockroach. What is cockroach? Tactile hallucination. Cocaine bug, also known as Magnum symptom. One more cola, remember? Coca-Cola. So that is made up of gold. You can remember like that. Gold chloride test. Antidote is amyl nitrate. Amyl nitrate. So all these are frequently asked questions. Amyl nitrate, gold chloride test, tactile hallucination, black tongue, nasal septum perforation, nasal swab is preserved. All these are very commonly asked in the exam. Yes, anyone can guess what is dry wine? Dry wine. This can be asked. What is dry wine? Yes, come on. Dry wine. Come on. Who is going to answer? Dry wine. Very interesting. Okay, wine, wine party, alcohol party. So dry wine, what is that? What is a dry wine? Come on. Try, all of you, try. One question, dry wine. Very good. Your drug of choice said, sir, chloral hydrate. Yes, it's chloral hydrate. Chloral hydrate. Very good. One more question for you. Legal limit of alcohol is? Legal limit of alcohol. Drink and drive. Drink and drive. What is the answer for this? Legal limit of alcohol for drink and drive in India. I'm talking about India. Okay. India. Yes, 30 milligram percentage. Anyone can guess what is the punishment for that? What is the punishment for first offense? What is the punishment? Second offense. Yeah. What is the punishment? That you can go through the Google. You can Google it. Now I'll go with 200. Who said no? 200 nahi hai, it is. Okay. Datura poisoning, 90 manifestation. Antidotes very commonly asked. You can go through this. I'll provide you this PDF at the end. So mushroom poison atropine, belladonna physostigmine, datura physostigmine, organophosphorus atropine. All is very important. Go through these antidotes. Pakka question, pakka very important question. Go through this after the class. After the very important antidotes, very commonly asked. Now let me ask you one more question about antidote. What is the contraindication for ball? What is the contraindication for ball? Yes, yes, come on. What is the contraindication for ball? British anti-Lewisite. Let's see who is going to answer. Contraindication of ball. Yes, come on, come on, come on. Ball, ball, ball. British anti-Lewisite. Huh? Dimer capital. What are the four contraindications? Anyone? Very good. Good answer. Sahil Thakur said. Vivek also said. Sakshi also said. Very good. Mnemonic याद रखना. PYQ is a mnemonic. PYQ. Okay. P for peanut allergy. Peanut allergy. I for iron. C for cadmium. C for cadmium. O for organic mercury. Okay. Organic mercury. Remember the name? PYQ. PYQ. Not PYKA. PYQ. PYKA in pediatrics, you know. PYQ it is the answer. PYQ याद रखना. This can be asked in your exam. Now we are talking about starvation. Some question about starvation. Last two questions, dear students. Patient died due to chronic starvation. All the organs are shrunken except starvation, chronic starvation. So what we can see here, loss of subcutaneous fat. So loss of fat all over the body. See here. Okay, so it can be marasmus, right? Can be marasmus or kwashiorkor, as you know, differences kwashiorkor. So question is very simple. Chronic starvation, all are shrunken except. Very simple. So liver is shrunken, yes. Spleen also shrunken, yes. Heart also, but gallbladder no. Gallbladder distended. Yeah. Starvation question can be asked. Acute starvation, chronic starvation. Okay. In how many days an acute starvation death going to death, the person is dying? For example, no food and no water. No food, no water. In how many days the person is going to die? Even can you guess? Food, no food, no idli vada, no roti, nothing is there. No water only. So there is no water to drink also. In how many days the person is going to die? One. Anyone can you guess? Niyas. Niyas देखो पानी नहीं है. Food भी नहीं है. Yes, 5 days. I'll talk for 5 days. Dr. G, 5 days. 1 to 3 days, beta. No, no, 1 to 3 days. So no, Vivek. One day he will die. Yeah? How? Fasting. 5 days. But according to standard textbook, Reddy. Reddy is telling. So Reddy answer is the final answer, right? No food, no water. No food, no water. The answer should be 10 to 12 days. 10 to 12 days. Person is going to die, beta. Die. Okay, die. Die it is. For example, only water is there. Only water. How many days person is going to survive? Only water available. No food. No food. Food nahi hai. Only water is there. How many days person can survive? Yes, come on, tell me, guys. Waiting for your answer. Yes, R tell 45 days. Better 45 days. Very good answer. Is around 48 to 60 days. 60 days. 6 to 8 weeks. Reddy is telling is around 48 to 60 days. 6 to 8 weeks. Okay. 6 to 8 weeks is the correct answer, or days 48 to. One more question asked in the exam. Intense hunger. Intense hunger. Intense hunger pain occurs for how many days? Intense hunger pain occurs for how many days? Yes, anyone? How many days? Acha, okay. Fine, fine, no issue, beta. Okay, yes. So intense pain for about 48 hours. Okay. For first 2 days, there will be lot of hunger pain. Pain. After that, no pain. Nothing. 48 hours. Asked in- One more question asked. So brain atrophy, that is atrophy seen in all the organs except atrophy of all organs seen except atrophy. That is allotropy of the organ seen except that is brain. Okay. Brain preserves its taste and okay. Good answer. So all these are commonly asked questions. Now the last question. Last question from forensic psychiatry. Final answer, all of you. Forensic psychiatry. In forensic psychiatry, one very commonly asked question: delusion. Delusion, though you must know. Must be knowing in psychiatry. Can be hallucination. Hallucination, commonly asked. Illusion, very commonly asked. Insanity, very commonly asked. Insanity. Rules of insanity, 84 IPC, very commonly asked. Daram's rule. All these rules are very commonly asked. Okay. So now we are talking about delusion. Delusions. Patient believes that he is referred by all agencies like media, persons. Whenever he watches TV, he thinks that whatever happening in TV is somewhat related to him. So whatever happening around him, that is related to him only. So he referred by all agencies, media, person. This is commonly seen in schizophrenia. है ना? Schizophrenia. Schizophrenia, beta, schizophrenia. Split personality, right? Split personality. What is the answer? What is the answer for this? What is the answer for this? Yes, all of you. Delusion of reference. Delusion of reference. The correct answer. Okay. Now, nihilistic delusion. Anyone can answer what is nihilistic delusion? What is nihilistic delusion? Where it is seen? Nihilistic delusion, also known as delusions of negativity, delusion of negation. The world is going to end. Everybody is going to die. I am going to die. You are going to die. Something like that. So delusion of negativity known as depression. I am dead. Yes, I am dead. End of the world. Yes, everybody going. You are going to die. I am going to. Negativity about self. Negativity about the Beckstrad is asked in recent INC, right? Beckstrad. So it is commonly seen in depression. Depression में होता है, and it is also known as Cotard syndrome. Cotard syndrome. Cotard syndrome. Okay. Now one more, all of you. What is that? Erotomania. Anyone? What is erotomania? Erotomania. Anyone can answer what is erotomania and common in males or females? Erotomania. Delusion of love. Delusion of love. It's common in females, right? MS Dhoni is in love with me. The female thinks that MS Dhoni is in love with her, and he admitted that he never met him in her lifetime. And erotomania is common in females, but is the common in females. Can be asked in your exam. So, Cotard syndrome is asked. Delusion of doubles. What is delusion of doubles? All of you. Delusion of doubles. 𝐒𝐿 syndrome. Good. Acha, okay. Sugana Medax telling, Sir, Alia Bhatt is love with me. Alia Bhatt is correct. Okay. He always thinks that Alia Bhatt is in love with him. So at the same time, it is possible, right? Okay. 𝐒𝐿. Good. What is that syndrome of morbid jealousy? Anyone can you guess? Morbid jealousy. Morbid jealousy. Morbid jealousy. So the husband or wife always thinks that wife or husband or partner is unfaithful. They're having some extramarital affair. So this morbid jealousy is commonly seen in chronic alcoholism. What is the syndrome known as? What is that known as? Very good. Who answered? Your drug of choice. Vivek R also answered. is known as Othello syndrome. Beta, we are very good. Othello syndrome. Good. Othello syndrome. This is what required. So delusion of doubles known as Capgras syndrome, Rigoli syndrome. Need to go through that. Okay. So what are important questions from forensic psychiatry? Types of delusion like bizarre delusion, delusional jealousy, erotomania, grandiosity, being controlled, reference, persecutory, thought broadcasting, insertion, mood congruent, incongruent. All these are common. You must know all these types of delusion can be asked. Anyone, what is the most common delusion? Most common delusion? Most common delusion बताओ क्या होती है? Most common delusion. Okay, आपका है no problem. Definitely it will come. Why are you worrying? So, but your knowledge is very good. Okay, your drug of choice, Sandeep R. Vivek Matak. So you are going to get sick. Don't worry. You are going to get sick. So take my words. Okay. So it is a delusion of perception, right? So that is the okay. And also you must know 84 IPC. 84 IPC. 84 IPC can be asked. 84 IPC. It is the rule of insanity. Rule of insanity. Rule of insanity. Also known as McNaughton's rule. McNaughton's rule. McNaughton's. Yeah, other rules are there. Durham's rule. Okay, Durham's rule. Current's rule. Okay, Durham's rule, Current's rule. American Law Institute test, ALI. American Law Institute test. Irreversible, impulse of irreversible. So impulse test, okay, impulse behavior. There are many actually. McNaughton's rule, Durham's, Current's, American Law Institute test. All these are rules of insanity. In India, we follow 84 Act. 84 Act. Okay. Anyone in my class who was McNaughton? Who was McNaughton? Anyone can you guess? Who was McNaughton? Who was McNaughton? Okay. Who was McNaughton? Who was McNaughton? Let him tell me. McNaughton बताओ. Who was McNaughton? McNaughton. McNaughton कौन था? Tell me. Yes. Yes. On. Was he a doctor or a judge or a person who died or a patient? Come on, tell me. Yes. If you answer, you'll get 3D chocolate for me. Get 3D chocolate for me. Chocolate for me. The group. Get. You'll get chocolate from me. Advance. Advance chocolate is given to you. Okay. Yes. Good answer. The chocolate goes to Mr. Sahil Thakur, Vivek Pathak. And yes, he was actually patient actually. He was the prisoner. He was the offender. He was the offender suffering from delusional disorder. He was having delusion of persecution. Okay. Yes. Good. And some more important topic you must know is heavy metal poison. Beta, arsenic. Arsenic to pakka question will come. Arsenic. Pakka question will come from lead. Mercury. Okay. Thallium poison. Thallium. And recent bouncer barium poison. है ना barium था एक question. Recent NEET exam. Hypokalemic paralysis was the question. Okay, arsenic, lead, mercury, thallium, barium can be asked. Phosphorus can be asked. Phosphorus very important. Okay, all these are important. Plumbism and all very commonly asked. Good. Must know this. And one more important topic is drug addiction. Drug addiction, especially alcohol. Alcohol we discussed today. Opioid addiction. Okay, opioid addiction very frequently asked. This you must know. Opioid addiction. Okay, cold turkey syndrome and all. Age estimation also important. Sahil Thakur, age estimation so very important है. ना age estimation very important, especially age estimation from carpal bones. So carpal bones is important. Carpal, sometimes they ask question from knee joint and other, but carpal bone to you must know. Okay. Gustafson method you must know. And the postmortem changes. Okay. PM changes to pakka question. PM changes, especially rigor mortis, algar mortis, liver mortis, atria mortis, all this can be. Okay. And few questions can be asked from hanging and other topics. So that's it about the today's discussion. Okay, sir, please tell about age estimation in short. Sir, this already there. Uh, teeth also important. Teeth also important. Achha, teeth. Should I tell teeth? So age estimation. Remember, age estimation can be done with the help of Okay, we'll discuss that slide. Don't ask me about the actually. Okay, carpal bones we'll discuss. Okay, carpal bone है ना, very commonly asked. Carpal bone asked. Okay, carpal bone. You must know in detail about carpal bones. Takes lot of time, but this is what asked in exam. Pakka question from carpal bone. Okay, carpal bone. I'll discuss only the carpal bone. Rest all you can go through the our videos. Sir, my score is 459 on batch. So I think better you have to yes, Bharat. Bharat, I think you need to go through like a weaker subject. I think probably you are weak in one or two subjects. Probably PSM, forensic medicine, some minor subject like psychiatry and all. You go through that, you'll definitely get a good rank. Hmm? So to get a good rank in your entrance exam, you must read all 19 subjects in an average. All 19 subjects in average. It's not like only medicine, only surgery, only forensic medicine. It is all 19 subjects. You must be like an all-rounder, like a Yuvraj Singh. Yeah, batting, bowling, fielding, like that. So all 19 subjects you must read. In an average, I'm telling you, an average. Psychiatry also, Aftal also, ENT also. So you just think about your studies. You just analyze your studies. You must be weak in one or two branches. Maybe PSM, maybe ophthalmology or forensic medicine. Just concentrate on that. You will get good rank this time. 100%. 100%. Yeah, pakka 100. No doubt. Bharat. Thank you, sir. Thank you. Thank you, Sandeep, sir. Great it is. 19 subjects पढ़ना चाहिए. Now we are talking about carpal bones. देखते हैं carpal bones. Which is the largest carpal bone? Anyone can you guess? Anyone can you guess? Carpal bone. Carpal bone, largest carpal bone. Anyone can you guess? What is the largest carpal bone? Largest carpal bone. So look at this image and answer. What is the largest carpal bone? Very good. So capitate है ना? Capitate is the largest carpal. Capitate. Can identify where is the capitate here? So 1, 2, 3, 4. Where is the capitate? What is this? Largest carpal bone, है ना? Look at this. Largest is capitate. You answered. Largest here is the one, middle one. So this is capitate. When it is going to appear? 2 to 3. Very simple it is. 2 to 3 months. Okay. Earliest fuse. Remember, carpal bones never fuse. Remember, carpal bones never fuse. They only appear, never fuse. So correct yourself. Carpal bone never fuse. They only appear. Very interesting. Capitate 2 to 3 months. Capitate, is having very good friend. His name is hamate. Hamate. Because hamate is having a hook. Around also 2 to 3 months. 2 to 3 months. 2 to 3 months. Yeah. 2 to 3 months. Earliest to appear, largest carpal bone. So where is the hook here? Hook dekho. Next to that is the hook. Is the hamate. Hamate is that. Okay. Hamate. Okay. Next comes is the that is triquetral. 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 Anyone? When it is going to appear? Triquetral. When it is going to appear? Can you guess? Answer all of you. Triquetral. When it is going to appear? Triquetral. Triquetral. Come on, come on. Triquetral. Triquetral. 3 years. Remember, tri is there, no? 3 years. Remember, 3 years. Lunate. Lunate is there, which is moon-shaped bone. Moon-shaped bone. I can remember like the moon is there, no? Moon. M-double-Y-N. My favorite. Chandamama, moon. Chandamama, moon, Chandra, So moon matlab 4 years. 4 years. 4 alphabet. Moon, 4 years. Lunate is 4 years. Lunate is 4. How to remember? Chandamama, moon. Moon matlab 4 years. Triquetral. Tri matlab. Capitate, largest carpal bone, 2 to 3 months. Capitate is a very good friend of Hamid, like Dhoni and Jadeja. So CSK. So, so one set is over. Now the second set. Now we are talking about next bone. Next bone is scaphoid. Scaphoid. Scaphoid, like all of you. Scaphoid. You can remember scaphoid. Anyone can answer what is the scaphoid when it is going to appear? Scaphoid. Scaphoid, anyone can guess? Scaphoid is going to appear in. No, scaphoid is some boat-shaped bone, boat-shaped carpal bone. So S-shaped carpal, yes, matlab resemble like 5 years. Can you remember? Yes is 5 years, 5 to 6 years. And one more question here. Scaphoid is the commonest carpal bone undergoing fracture. Very commonly asked. Boat-shaped bone, boat, scaphoid abdomen and all, Okay. Next comes is the trapezium and when they are going to appear, trapezium and trapezoid. Trapezoid. When they are going to appear, they are good friends. Again, like your, Dhoni and Jadeja, Raina. So they are usually 6 years. 6 years. 6 years. So now the last one comes with the physiform. Physiform is a P-shaped bone, small bone, which appears at 9 to 11 years. 9 to 11 years. 9 to 11 years. Okay. Okay. So all these are common. Smallest is physiform, largest is capitate. And they never fuse. They never ever fuse. Okay. So, okay. Now look at this. This is the lower end of radius and ulna. And it is not fused. So lower end of radius and ulna, they are not fused. That means less than 18 years. So they are going to fuse by 18 years. So lower end of radius and lower end of ulna, they are going to fuse by 18 years. So this is the thumb, right? This is the thumb. So this must be radius. This must be radius. Okay, radius. If it is fused, more than 18 years. Not fused, less than 18 years. This is how you can remember. So many questions can be framed from this. This is physiform. And this is physiform, capitate. This is scaphoid. This is lunate. She looks too pretty. Try to catch her is a mnemonic, old mnemonic. Anyone? When lower end of radius appears, anyone can guess? Lower end of radius when it is going to appear? Lower end of radius when it is going to appear? Lower end of ulna when it is going to appear? You can see here lower end of radius here. It's a lower end of radius. This is lower end of ulna. You can see here R for radius, U for ulna. When it is going to appear? Come on. Who is going to answer this? Come on. Try. Radius. Radius, yaad rakhna, it is 2 years. Radius, 2 years. Ulna, it is 4 years. Ulna, 4 years. Okay. So this is very commonly asked, dear students. So remember, capitate 2 to 3 months, hammer 2 to 3 months, triquetral 3 years, lunate 4 years, scaphoid 5, that is scaphoid 5 years, trapezium and trapezoid 6 years, physiform is 9 to 12 years, 9 to 11 years, lower end of radius 2 years, lower end of ulna is 4 to 5 years. Fusion occurs at 18 years. Is it clear, all of you? Is it clear? Vivek Pathak and others? Clear? Now look at this and try to answer, what is the age of this man? Age of this, it is 18 years we discussed, right? Okay. One more easy thing is there, I'm telling you. So between 2 to 6 years, number of carpal bone is equal to age, is equal to age. One more easy way to remember. Okay. Number of carpal bones, say 5 are there, age is 5. 6 is there, 6 is the age. 3 is there, 3 is the age. Like that it is. Between 2 to 6 years, number of carpal bones is equal to. Like this, we discussed all the ossification center in PW classes. All the ossification center in PW classes we can go. So this completes the marathon session, and that is a forensic session. I hope you understood all the important topic. Any doubt you can message me in the WhatsApp group or in Telegram group. You can message me. Okay, we are there to help you. We are there with you, Vivek Patak, Dr. G, Dr. R, Bharat. We are there till your exam. Don't worry. Okay, Dr. G. So you analyze yourself, weaker subject, and go through that. Start reading that and revise notes. Revise notes. That should be done from today onwards. Hmm? Sit back and relax. Okay, I'm weak in anatomy. Okay, little weak, or I'm weak in psychiatry. Like that, you can think about yourself and read. So, according to me, hard work is very important. At the same time, the very important component is revision. Telling you, all of you, revision. Revision is the most boring thing. The most boring among the three is revision. Hard work, revision, and analysis. Analysis, but very important is revision. The more revision, more good rank. More revision, more good rank. That's how your rank is decided in your upcoming. Revise more, revise your notes. You keep some 2-3 hours for revision every day. No one. So more revision, more good rank. So that's it about the today's class and the last session. All the best, all of you. All the best. Wish you all the best once again. And any doubt, free to ask in the group anytime in YouTube also or anytime in Telegram group. So revise, revise, revise. That's it about the forensic class. Thank you. Good night.